Scientists work with artificial intelligence to predict outbreaks and identify threats. In the case of the new coronavirus, AI helped spot and track the outbreak. But how exactly does this technology work? And how reliable are AI predictions? Let's take a look.
1, 2, 3, 4.
AI-powered systems such as HealthMap, founded by the Boston Children's Hospital, collect and integrate outbreak data from around the globe. They use machine learning algorithms and big data to assess how big a threat a given infectious disease is. Canadian startup Blue Dot was one of the first to sound the alarm on the new coronavirus.
In the case of this novel coronavirus, on early morning, December 31st, in the early hours of the morning, the machine algorithms that we had just talked about picked up an article in Chinese that was talking about a pneumonia involving 27 people associated with this wet market, this animal market in Wuhan.
In order to also spot new and unknown diseases, thousands of different sources are searched, including medical databases, press reports aggregated on Google News, and China's Baidu News. Johannes Starlinger is a doctor and computer scientist. He explains why AI is needed for this type of content sourcing.
Diese große Menge von Informationen und die Heterogenität dieser Informationen, die lässt sich durch Menschen teilweise sehr schwer bewältigen. Und dafür braucht man solche Plattformen, die einem genau auch über die Art der Verbreitung, die Wege der Verbreitung und auch die Geschwindigkeit der Verbreitung und der neu auftretenden Fälle Auskunft geben.
The AI in question is Natural Language Processing, or NLP. This gives machines the ability to process and analyze human language. NLP breaks down text into their various elements. This means that location and time references can be identified.
Computer sind von Haus aus ja eigentlich eher doof. Ne? Das heißt, die können sehr gut mit Daten, Zahlen, strukturierten Inhalten umgehen, aber nicht so gut mit Freitext, mit Sprache eigentlich, also mit menschlicher Sprache. Und was NLP macht, Natural Language Processing, ist aus dieser natürlichen menschlichen Sprache, aus Texten, die in dieser Sprache verfasst sind, Daten zu extrahieren, damit Computer dann mit diesen Daten weiterarbeiten können und zum Beispiel Statistiken erstellen und so weiter.
Different NLP networks can be trained to analyze different languages, allowing the AI to monitor developments around the world. Natural language processing already plays a role in our daily life. For instance, online translation platforms and virtual assistants like Siri rely on it to recognize and process human language. One of the reasons why NLP is so helpful in fighting pandemics is that different NLP networks can be trained to monitor different languages, so that developments around the world can be tracked at the same time. But how reliable is this technology really?
Grundsätzlich ist es eine gute Sache, weil es halt sehr viele Informationen gibt, die global vernetzt werden wollen, um dann auch Visualisierungen zu machen. Man muss gleichzeitig natürlich immer so ein bisschen im Auge behalten, dass diese KI-Lösungen nicht mit 100%iger Genauigkeit arbeiten. Das heißt, es kann durchaus passieren, dass sie gerade bei neuartigen Erkrankungen oder Symptomatiken unter Umständen nicht gleich erkennen, worum es geht.
AI-powered systems make predictions, and those predictions are not always accurate. In late December 2019, HealthMap did issue an alert about unidentified pneumonia cases in Wuhan, China, but only ranked the seriousness level as 3 out of 5. For an alert system to be truly efficient, AI needs to be combined with human intelligence. And while AI-powered disease alert systems can be very useful tools, they shouldn't determine public healthcare policy making. But artificial intelligence is far better than humans at predicting how and where a virus might spread, which can be vital in fighting pandemics. And automated systems have one major advantage. They never get tired and can work all day, every day.
What we are trying to do is to really push the boundaries to be using data and analytics and technology to keep moving faster. If we really think we can get in front of these infectious diseases, we're going to have to move faster than they do. And they move very, very fast.
Medical experts fighting a disease outbreak need reliable, up-to-date information to take the right measures and to give hospitals maximum time to prepare for possible infection spikes. AI-powered systems like Blue Dot can assist by predicting how and where a virus will spread. With COVID-19, it combined infos on confirmed cases, airplane ticket sales, and even climate data.
Das ist so ein bisschen wie die Wettervorhersage. Also schlussendlich sind die Systeme für die Wettervorhersage auch heutzutage verhältnismäßig ähnlich. Also gerade Blue Dot, wenn die auch zum Beispiel so Fluggastdaten heranziehen, dann kann natürlich mit einer gewissen statistischen Wahrscheinlichkeit gesagt werden, dass das Land, in das die meisten Auslandsflüge aus China heraus getätigt werden, der nächste Angriffspunkt der Erkrankung des Virus ist.
Will AI actually help make our lives safer? Or is this technology being hyped? Let us know what you think in the comments. And don't forget to subscribe.